So you're welcome to Synergy International Nursing Network, RCSI OSCE Study Buddy Program. And for nurses that are planning to relocate to Ireland, especially coming through the pathway of examination, then you will need to do RCSI CBT and as well as the practical, which is, we call it OSCE. So for those that don't know what an OSCE is or what the RCSI CBT is, the RCSI is the Royal College of Surgery Institutes in Ireland. They are the ones that coordinate the exams as directed by the Nursing and Midwifery Board of Ireland. So the RCSI coordinates these exams. So you have two types of exams to be done. The theory one, which is called the CBT, computer-based test, and as well the practical test, which is the OSCE. So I'm going to share just as an overview the websites. So as well, I'm going to share the details of the websites for the RCSI, because usually you should have additional understanding of these, additional reading. You're going to have access to a lot of things there. Okay. So just give me 1 second and I'll get the website out there for you. Okay, so you can see my screen and use the chat box to just put the thumbs up and say yes. So this is the RCSI University of Medicine and Health Sciences. This is the page. Once you register for the exam, so for those that if you are self-sponsoring, so as soon as you register, you've paid the fees, the RCSI will send you an email. They'll send a comprehensive email of this website, where to go, what to do about it, and the likes. So this is the page you get to. I'm just going to go over there and start from here, overseas aptitude testing. Okay, and I'll send the link into the chat box. So in case you want to check it out yourself later on, maybe after the class. So I advise that you click on that link now so you have it opened. I could also send it on to your email or your mobile number. All right, thank you. So this is overseas aptitude test. That's the page you get to. So I'm just going to run through what the aptitude test and all that is all about. So for you to work as a general nurse in the Republic of Ireland, you must be on the register of the Nursing and Midwifery Board of Ireland. If you're trained outside of the Republic of Ireland, so the first consideration is to apply to the NABI for a recognition of qualification. So for you to be doing this course, I believe you started your registration, either waiting decision letter or you have received a decision letter. So a decision letter will be asking you to do either, if you are given a decision letter for consideration, maybe to do an aptitude test or to come in through adaptation. So if you're coming through aptitude test, so you definitely need this page. All right, so the structure of the test for the RCSI comprises of two parts. The part one, theory or knowledge-based or MCQ. So which must be successfully completed before part two can be attempted. So usually this is done in a day. Within 2 hours, you're done with the exam with the MCQ, also known as the CBT. All right, and then you get your results before the end of the day, almost immediately. You get the results, and then you are given an invitation for the practical, which is the OSCE. So we've had instances that some candidates might not pass the theory aspect, and they have to do it again before the practical. So both parts of the test are based on the NABI standard and requirements for nursing registration education programs. As well, I'm going to share this link with you, and you need to go through this link as well. Get yourself familiarized with the requirements, the education standard and programs for nurses in Ireland. So this test will examine your potential suitability for registration, just like every other board registration exams. They just want to see if you have the necessary skills that makes you suitable for the work in this particular environment. There are 2 attempts. So 2 attempts that includes 1 repeat are allowed for each of the 2 parts of the test. So like I was saying, that if a candidate does the theory and didn't pass, you can have another attempt before, and of course you should pass at the second attempt for the theory. Then you'll be given an invitation for the OSCE. As well, if a candidate fails the OSCE, is given another attempt, to receive the OSCE. So an applicant who fails at the first attempt of the practical will be required to receive the OSCE stations failed. Whereas the MCQ, you just have to take the whole MCQ again, about 150 questions thereabout. So, but for the OSCE, we'll get there for more details. You only we see the stations that were failed. So you must allow sufficient time to prepare for the second attempt, and a minimum of 2 weeks is recommended in between. Hopefully there won't be any failing. These are just like overview information. All right, so there are some principles underpinning the test. In the Republic of Ireland, registered nurses are accountable healthcare professionals working within the scope of practice, just like every other registered board of nursing. So fundamental to safe patient care is competent registered nurses. So that's the essence of this. There are priorities, there are principles that underpin the practice and as well as the test. First one is the priority to ensure that patients and public are protected. The test must assure the NMBI that the assessment, is effective, safe, and will provide a competent practice. The assessment is usually robust, fair, and objective, and there are valid and reliable assessment methodology. It also provides a responsive, efficient, effective, economical, and equitable assessment for all applicants. Now, the exam is usually done in Dublin, in Ireland. So if you are in overseas, you definitely need to have applied for a visa, an exam visa, to come and write this exam. So this exam is not done online or wherever in any other country. It is done in Ireland here, in the Smithfield building, Beaumont Hospital, Dublin 9. Both parts of the exams are done there. So there's that RCSI does not endorse or approve any training or preparation course for the test. Of course, there is no official training from the RCSI for tests, for practices, for training, but based on experiences. So we conduct this test. Many nurses have gone to this. I did the exam myself and a couple of other nurses as well. Like I said, it's either you go to the adaptation or you go to the aptitude test. So these are based on experiences. Is that okay? All right, so that's just as an overview. So I'm going to go again to the theory test. So for the RCSI, you have the theory test that I've explained. So the theory test consists of supervised online assessment of professional knowledge and understanding, known as MCQ. You are required to answer 150 questions over a 3-hour period, which is reasonable. And each question will have 4 possible answers, and you are required to give only 1 answer to each question. A minimum pass mark of 50% must be achieved in the theory test, and you will not be permitted to leave the test until 60 minutes has passed. Remember, you have 3 hours. So if peradventure you've completed the 150 questions within 1 hour, then you can leave the test. Let me show you here a sample of the MCQ. That's the way the question comes. So you have a question and then you have the options. Like I said, I've sent you the link so you could take your time to go through this so that we can begin. Just pick on the topic and go ahead. So for the CBT tutorials that we do and all that, so you have access to the links on the website and you can go ahead and keep practicing as much as possible. The recommended textbook for this practice is the Royal medicine textbook, which can be gotten online, can be purchased online, either hard copy or e-copy. Send you the link of that if you don't have it yet. So you see, these are the kind of questions. I'm just scrolling through that because that's not the focus of today's class anyways.
To transfer to the mobile linking order line, press 5.
Now, so about the practical test, like I said, that's the second aspect, and they use the objective structure clinical examination, the OSCE. I'm sure if you're in OSCE, you would have come across this methodology at one point or the other. So you are required to complete 14 stations. So a station is like a setup clinical setting and has all the necessary equipment. It's not necessarily like an hospital. So they're just simulations. You're required to complete 14 stations. Each stations will assess different competencies pertaining to general nursing. Okay. For each station, there is a descriptor sheet that will be displayed both outside and inside the station. The station is like a kiosk like that. So like when you have a room or something that you can enter, there will be a door. So you will have the descriptor sheet on the wall, so you can read on the wall, you know what you want to do, and then you go inside, and you also have that same descriptor sheet at the back inside the station. So this is available for you to refer to as you need. So you need to spend 10 minutes at each station carrying out the care as per the station descriptor. There are a number of aims and competencies that are expected of you to achieve at each of the station. Okay, so when the time is up, the assessment will end, regardless of whether or not you are finished. So timing is another factor that you need to put into consideration. Generally, for candidates, we know that anxiety and exam fever and all that could come in, and even the things that you might spend more time doing them. But with practice, and more confidence being instilled during the course of this study body, I believe that would not be an issue. There are trained assessors at each station. So your assessors, you have people there that are maybe like observer, they are assessors as well. So everyone is assessing you. Just consider that you are in an exam environment. Some stations may have a mannequin rather than human figure. So you may have to work on a mannequin, maybe for wound dressing or for something or like that. So sometimes your stations can have your assessor acting as a patient or a relative or a staff member. So you have to pay attention for that. Assessors consider the applicant performance and mark as competent, that's pass, or incompetent as they fail. In order to pass the practical parts, the applicant must be deemed competent in each competency at each station. So you have to pass all the 14 stations. Now, so there are basic scenarios for the OSCE. Just sample scenarios there. I'm going to show you so you see that. So each station has a station descriptor. I've mentioned that. So let's see a sample of a descriptor. So I'm gonna have to stop the share and open another one, okay? New share. Okay. If you can see this new share, can you just use the chat box and say yes? Thank you. Okay, great, thanks. So this is the way the scenario card would be. You have a sample scenario. So this OSCE sample 1, this station is asking you, using ISBA, communicating a patient deteriorating condition, head injury. So you are communicating a patient deteriorating condition, which is head injury, using ISBA. So we're going to talk about ISBA when we begin the classes, but just take a look at the descriptor. So every descriptor will have a purpose. So don't take this for granted. You need to read the purpose. The purpose in this sense is to assess how you communicate a patient's deteriorating condition to a team member. Underpinning the station is your competencies and patient safety. So this is the scenario. Mr. Brownie is an 86-year-old man who fell and hit his head yesterday. He sustained a laceration to his forehead. He suffered from concussion and was admitted for observations. You have just carried out a new set of observations. There are changes to his neurological observations. That's the scenario. Now, what are you required to do? You are required to fully consider the scenario or situation. What does that mean? That means you have to really read through that scenario, digest it, reflect on it, okay? Now, analyze the scenario or situation taking into account, first, your analysis of the patient neurological observations. Now, it's been said there that he suffered from concussion and was admitted for observations. You have carried out a new set of observations. So it said, you also take account your professional judgments. Now, complete clearly and accurately in writing each stage on the ISBA communication tool. So there is what we call the ISBA communication tool. You're going to have access to it. It's one of our CBT courses that you'll see as well. So the other thing you are required to do is to contact Dr. Ima via telephone and using the ISBA communication to provide a clear rationale on why and when he should come and review the patient. Effectively and assertively communicate in an accurate, clear, effective, and systematic manner. Demonstrate a level of competence essential for safe practice. Those are what you are required to do. You'll be assessed on the following competencies: your professional values and conduct, nursing practice and clinical decision-making competencies, knowledge and cognitive competencies, communication and interpersonal competencies, management and team competencies, leadership and professional scholarship competencies. So to have more information about this, I'm also going to share you the domains of professional practice. You'll find that in the link I sent earlier regarding the regulations and standard of nursing in Ireland. So you find more of this just for you to read through over there. So that is one station. Then you have another station. Remember, this is just a sample scenario, okay? You have another station, wound care. This is the title of the station. You have a purpose of the station is for you to assess, the purpose of this station is to assess how you carry out a wound dressing. Underpinning the station is your competencies and patient safety. The scenario description is the patient, Mrs. Green, is 2 days post-surgery and requires changing of a wound dressing. So as we talk about this, you can reflect what kind of dressing, what kind of wound will this be post-surgery, and what kind of wound and what do you think you will require for this dressing? Remember that this is a station and everything will be supplied, will be available within your reach. All you just have to do is to set it up. So you are required to go to the patient and carry out the necessary patient and environmental checks. Loosen and remove old dressing. Now, may I say this? You see, you are required to, this is what it is, you are required to do this. You will find this there, but you have to practice it. It's the practice that it will be scored. Even though you're already told what to do, which is much more easier than what we are used to from our country. Nobody will give you a step-by-step of what you are required to do. So, but this time you have it. This is what you're required to do. They only want to see you carry it out. All right. So you are required to go to the patient and carry out the necessary patient and environmental checks. Loosen and remove old dressing. Set up for the dressing. Clean wound. Put on new dressing. Dispose of waste. Clean the trolley. Set up the trolley. Adhere to an aseptic technique throughout. And state throughout what you are doing, when you would clean the hands and how, when you would put on and take off apron. Communicate in accurate, clear, and effective manner and demonstrate a level of competence essential for safe practice. Okay, so these are the things you are required to do. You have to do them. For things that you can't do, then you have to say what you're going to do. Like, what are you doing? You have to be talking as you practice it, as you do those things. Like, I'm going to wash my hand now. I'm going to, so you really have to be talking about this. So that's basically the a sample of the stations, if that is okay. I'm going to pause the recording again in case there's any question. Now, so after we'll talk about the theory and the practical test. So how do you prepare for the test? The RCSI, they just put like an outline of what and what you should prepare for here. Like I said, I've sent you the link of the NMBI, the Nurse Registration Program, Standard and Requirements, the 4th edition, which is the most recent edition for you there. So you go through the website and just refer to page 11 to 72, scan through, read through. Yeah, you still have the time, read through, especially the domains of competencies of professional practices, the scope of practice, the code of conduct. So I'm going to send you a specific link for this as well. And on the website that you can also find, you will also find the minimum background reading. Now, underline, see the word underlined there, minimum. That means you should read more. Okay, so these are just the list of the minimum background reading that you should go through. Disease conditions, you find different links to disease conditions there. Neurological, these are basically like nutrition, malnutrition, screening tools, how to assess for neurological deficiency, pain management, renal respiration. So you have all this list, all this link that you can go to and read. When I say read like you are going to use it, because it's the same thing. You need it for the CBT, for the theory, the MCQ. You also need it for the practicals. So most of these questions come from this link. Like, well, these are just minimum background reading. Communication, remember I was talking about ISBA. So you have different links there. So you have the link now, you could go through and start ticking your box of I've read this, I've read this, I've read this. Honestly, you have to read through everything. I remember when we were preparing for our own exams then, we had to go through everything. Okay, and medication preparations as well. You have a link to all the medication stuff there, nursing process, observations, professional issues, and the likes. So for general reading, I'm going to send you the link. They use the Bruna and Suda textbook. If you still have yours, I have mine, it's just in Nigeria. And Royal Marsden Clinical Nursing Procedure, United Edition. So these are the general reading. You can find details of the nursing procedures and all that in those textbooks. So if I find the link to that's Royal Marsden or the Bruna and Suda, I'll send it to you as well. So take a look here, the stations and equipment. So look at the test venue. That's the test venue where you'll be having the exam. And this is theory test room. You have your computer there and you sit down gently there. And now the practical test room, remember I mentioned the station. So you have it like a station there. You have, that's the way the hand soap and the hand gel, just the things that you might use. Elbow tap, the sharpens, observation, so like the BP machine, the pulsometer, and the other things there. For dressing, so this is the way you have your dressing pack. IV therapy, respiration, like oxygenation or nebulization. So those are the equipments there. Again, if you look at this link, you can play, these are videos there that you can use to play and see just some basic, what I call it, demonstration there. Okay, so that is about test preparation. I'm sure you're aware of how much you have to pay. I'll just go through that. quickly for the exam. So for the exam, you have to pay 2,800 for the NMBI for the exam, both papers, okay? And that's the bank details. The next test opens the November. So if you're planning, if you want to do this, you might want to book ahead. So always check the next test open like